Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face to Facts, we're going to be talking about scar management, and this is, of course, not just in the face area, but that's just the name of our series, so here we go. So as long as a scar or a laceration or a trauma or an injury or something is within the first year of when it happened, it is still intervenable, meaning that you can still do different interventions to it to try to make it appear better or softer or whatever it might be. The easiest thing for you to do is to make sure that you are protecting it from the sun, as in wearing SPF and keeping it covered from sunlight out there, as well as doing massage, like actual manual massage to try to break up scar tissue. Beyond that, some of the more advanced techniques will involve doing things like anything with silicone. So silicone is one of the few things that we found that actually helps improve the appearance and texture of scars. And you can either get them in the form of silicone strips, which are available on a variety of places like Amazon, or you can use a silicone ointment. I like using biocorneum, which we have here because it has both silicone and SPF in it, so it's just a one-time application of something. But using silicone will definitely help improve the appearance and texture of scars. And then some of the other things that we also use in our arsenal will be usage of a steroid injection, and steroid meaning either triamcinolone or Kenalog, those are some of the names of them, as well as using 5-fluorouracil, 5-FU. These are all kind of off-label use, but they still help with improving, again, the appearance and texture of scars. Lastly, there's a whole bunch of things in the procedural route, such as microneedling, IPL, various types of lasers. These can all be added in as well at certain points, depending on what your scar is looking like and what we need to do in order to get it to behave a little bit better. The last thing I will throw out there, it's a little bit off-label and still a little bit experimental, is they are thinking or finding maybe that hyper dilute Botox or neurotoxin might actually also help with scar appearance, but it is still very, very, very preliminary. So if you bring that up to someone or your provider, they might not totally know about it yet, but that might be coming in the future. We'll keep it in the works for in the next few years if that's a thing. So in summary, there's a lot of things that you can do to try to help improve the appearance and texture of your scars. The most important thing for you to remember, though, is that it does truly take a full year for your scar to fully heal and mature. So don't panic or worry if your scar is still a little bit pink, a little bit raised at month 4 or even month 6. It takes some time, and that's why your plastic surgeon is going to see you repeatedly over the course of that 1 year as you're healing, so that way we can decide when we have to introduce any of these treatment modalities to help you with your scar and your healing. If you do, by the way, happen to be outside of that 1 year time frame and you're still worried about your scars, some of the more aggressive treatments, like the procedural ones I talked about, might be helpful for you, but you do need to know that it's going to have diminishing returns compared to if we were able to get something in before your 1 year point. Very commonly in my face consults, because I'm a facial plastic surgeon, a lot of patients will tell me, oh, well, I've had a really bad shoulder scar before, and so they're worried about how their face is going to heal. But the good news about operating on the face is there's such good blood flow there that usually just because you scarred poorly somewhere else on your body does not mean that you will scar that way on your face. However, if you do have a history of bad scars, it is helpful to show your surgeon just in case so they can plan accordingly. The last thing I will say on this too is that a lot of my patients, especially my rhino patients, are very eager to start their steroid injections early, and I do have to say you cannot do some of these too soon, because the way they all work is they selectively injure the healing tissue so that way you don't get abundant scar formation. But if you do it too soon, then you'll never get any healing at all, and that's also bad. So you do need to allow your body to do some degree of healing before you start injuring it a little bit to improve your scar. So usually I don't like to do things until 2 weeks to 1 month post-op at the earliest, but you might find that other providers have different thresholds of when they do that as well. In summary, this is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today's episode of Face to Facts was all about scars and scar management. Please leave any questions and thoughts you have below.